Okay, this is the prescribing document that I have here. So when you're prescribing, make sure you come up with at least a differential diagnosis. For instance, someone's coming in, female, 54-year-old female, complaints of body pain, stuff like that, and you've made a diagnosis of fibromyalgia. So you need to make sure at least that you have a presumptive diagnosis. Secondly, you want to understand the pathophysiologic implications of the diagnosis. So the more you can know about the pathophysiology, for instance, the impact of pain and pain receptors and or prostaglandins and different receptors involved in that, the more you'll be able to zero in on prescribing the right medication. Then you need to create a therapeutic objective. So for this patient, your therapeutic objective is going to be relief of pain. Then you have to come up with a medication choice. So you're going to have to consider drug-drug interactions, other diagnoses, age, cost of the medication, allergies, and fibromyalgia. There are many choices: antidepressants, anticonvulsants, pain medications like Tramdol, gabapentin. You have Lyrica, which is pregabalin. So there's a lot of options here. And dosing regimen, you have to come up with it's important to know the pharmacokinetics, and that's how the body, what it does to the drug when you ingest it, or topical, oral, and we'll be talking about that in the second class. Renal function, liver function, important. Monitoring, are we achieving therapeutic objectives? Side effects, so they need to know what to expect in terms of side effects. Duration, how long? Is it going to be forever? Is it going to be a short course? What are we going to do? When to call and when to bring them back in. So they need to know, call the office if they have some kind of really bad side effect. And when are you going to bring them back into the office? In 2 weeks, a month, 3 months. And education referral. So don't forget to educate your patient, and if you need help, so maybe the patient needs to go see a rheumatologist or immunologist or something of that nature. So let's scroll down here to elements of a prescription. So in the elements of a prescription, you can see on this example with the prescriber's name, Richard Fast, MD, medical group, address, Chicago, Illinois, phone number, fax number, then his license number, DEA. So you may have this, or depending on your state, you could have just the practice that you work in, and then your supervising physician, and then your information would need to be on there. Then you're going to have your patient's name and address, and then you'll need age, especially for pediatrics. You'll need to have a date that the prescription is written. Oh, and date of birth. You see that date. That's the date that the prescription is written. The medication. So a lot of times we're using generic, but it's okay to use trade names, but generic's better. Strength. So in this case, 0.3% Siloxane ointment. Dose, 2 drops. And SIG is kind of the directions. Quantity, SIG, directions for use, directions for refill. See, there's a quantity, 1 bottle, refills 3 bottles. So that all depends on what is it you're prescribing, how long, how many pills, how much solution that you need to have to cover for that full treatment time. And then prescriber signature and your license number, DEA number. I mentioned that already. So I would try to come up with some prescriptions and see what you can do on practicing that.